name is Brandy, and today I'm going to tell the audience about medication-assisted treatment for opioid use disorder. Let's take a step back from that and just imagine that you are 23 years old. You are living your life and you're in a minor car wreck. You get your back hurt, maybe your hip. You go to the doctor, they give you some pain meds because you're in pain. You're taking them like you're supposed to. A few years later, you have a back surgery and they up your dosage of your pain medicine. You're taking them like you're supposed to, and they're doing their job. Well, about 10 or 12 years goes by and your doctor retires, so you have to get a new doctor, and then they change some federal regulations, and so you're no longer qualified to get narcotic pain meds prescribed to you every day. So this new doctor tells you, well, we're going to wean you off of these pain meds. And so you're, okay, that's fine with me. And so they cut your dose by half, and you get home, everything's fine. That night you're trying to go to sleep, and you get a runny nose, and you get the cold sweats, and you kind of think maybe you might be getting sick. And by the next day, you're nauseated, you have diarrhea, you didn't sleep last night, and you got restless legs. So 2 or 3 days of this, and you're not sleeping, and you feel horrible, and you call your doctor thinking that you might have the flu. No, you're going through withdrawal for some medication that your doctor had been giving you for many years. And there's no way to get around that withdrawal except for go through it from what your doctor says. And so what you do is you're sick, you can't go to work, you can't do the things you normally do. Your coworker calls to check on you, and you say, well, I'm going through withdrawal. I've never done a drug in my life. I don't hang out with drug addicts, and I don't even know a drug addict. But here I am going through a withdrawal because my body's dependent on this drug. And your coworker's like, actually, I have something that'll make you feel better. And you're so desperate for relief that okay, please, let me, whatever it is, I'll do it. So you go to their house, and they have a piece of foil with a blue pill on it, and they're like, just smoke this and you'll feel better. Okay, fine. And so you go and you smoke the pill, and from the top of your head to the bottom of your toes, it takes everything away. It takes away the withdrawals, the pain, the cold sweats, everything. It just makes you feel all better. And you know that this is how you want to feel the rest of your life. And so you'll do anything to get that medication, to get that and make you feel better. So fast forward 6 months to a year later, you're homeless, eating out of dumpsters. Your life revolves around that drug. And the barrier from you getting that to there to sober is the withdrawals and the cravings. Oh, what if someone told you there was something that could help you with that? That's medication-assisted treatment, also known as MAT. That's how I'm going to refer to it for this speech. I'm going to talk to you about the medications used for MAT. I'm going to talk to you about how much more effective MAT is than traditional treatments, and I'm going to tell you a little bit about the misconceptions and stigma that go along with MAT. So there is methadone, is the first most common medication. Methadone mimics the effects of opioids. It's taken orally. There is buprenorphine that attaches to the opiate receptors. That is taken sublingually. There's naltrexone that also attaches to the opiate receptors, and it takes the withdrawals and cravings away. They all do. And so these medications, combined with cognitive behavior therapy, they are the most effective. And those have the best chance at long-term recovery for people with opioid use disorder. And there's lots of research on this. There's a common misconception that people that are on MAT, that they're not sober, that they're just replacing one drug for another, or whatever. There's a lot of them. But what it is it's harm reduction. And these people are people that would normally overdose and possibly die, but now we've got a way for them to get around that barrier, that major barrier, which was the withdrawals and cravings. So now that you know about the medication options, you know about the long-term effects, the lasting effects of it, how it's more likely to keep you sober, and the misconceptions and stigma. Maybe if you know somebody that's struggling with opioid use disorder here in the near future, you will be able to help them. Thank you.